I've been on the streets for 5 years and 2 months. Rain, shine, sleet, snow, cold, hell, heaven, everything. I was literally the guy on the street, living in the doorways, wherever. And I was told if I continue the path that I'm on right now, health-wise, I probably got a few years left.
In 2006, the Multnomah County Emergency Medical Services Office began getting a number of calls from fire and ambulance first responders asking for some help with frequent users of 911. That ultimately led to the hiring of a part-time social worker in 2007, 2008. They hired someone to study a bit more about the frequent user population and also look at whether a brief intervention might in fact have an impact on transports for non-emergencies, and that initial research was really promising.
I was abused physically, sexually, mentally, and emotionally. So I started using and drinking when I was 11. Things got really bad from there. I started stealing, lying, doing whatever I could, acting out. I couldn't stop. I ended up in 2009 robbing a bank. I was on drugs. So I went to prison for 2.5 years.
The Tri-County 911 program is a program of licensed clinical social workers that focus on individuals having frequent contact with 911 or emergency medical services in Multnomah, Washington, and Clackamas counties.
When somebody calls 911 frequently, it's because some need isn't being met. It could be no social services, housing, mental health, numerous reasons. What the TC 911 program was able to do is find out what that need is and direct them to the appropriate resources so that need is met.
911 seemed to be my only reliable source because I had no other way to deal with the problems. Falling down, disoriented, couldn't see visually, and drunk.
On more than one occasion, we've worked with clients that basically utilize multiple hospital systems. And so several of their social workers have kind of taken the lead and said, all right, we're going to all come together as a community and meet about this person. What interventions have been tried, what's missing, and what can we do outside of the box that hasn't been done before to kind of help this person or maybe reach this person.
Most of our clients have a pretty significant trauma history. Most of our clients have multiple behavioral, medical, and social issues going on at the same time.
I was in Tennessee when the World Trade Center collapsed, and I can remember calling home and talking to my mom and talking to my dad, and all hell was breaking loose. That's the first time I ever felt alone. And it was kind of wicked. Everybody was off the hook, so I drank even more. I think I had my own death wish, but I wasn't guts enough to pull the trigger. I pulled the trigger one bottle at a time, wishing I'd never wake up. It almost happened to me a bunch of times.
At the age of 14, my daughter was diagnosed as a type 1 diabetic. She is now 43. My daughter never managed her diabetes properly. And it got to the point where the disease was not only causing damage to her body, but keeping her from being employed. But the constant passing out from the low blood sugars. It's not her calling 911, it's her husband.
Portland Fire and Rescue goes on probably 72,000 calls a year. Of those, well over 50,000 are EMS calls. So when we're going on someone whose their acuity is lower in nature, it takes the same resource that we'd be using if someone has a cardiac arrest. So there's a delay in response for the true emergencies while we're taking care of someone who might just have a transportation need or a lower acuity signs and symptoms.
And it's also not the best thing for the responders. It makes them concerned they're not doing the right thing and that they're not doing enough for the patient as well.
80% of the healthcare costs are driven by this 20% of the population utilizing the ERs and the hospital systems.
We end up spending lots of time, lots of resources going back to try to fix a problem that we really don't have the resources to fix.
We use a variety of different approaches to find people. We'll go into the county jails to introduce ourselves. We'll show up at someone's homeless camp. Or we'll go to an emergency department. We'll do whatever we can to try and reach that person where they're at.
I had just got out of jail. I had actually gone to the doctor, got my medication, and made a plan to take all those pills. And I took 140 pills. Next thing I know, I'm waking up in ICU on life support. That was the scaredest I've ever been. I first met Erin when I was in jail, and I went to jail because of drugs. And she came in saying, hey, you know, we've noticed that you call 911 a lot, that, you know, because, you know, of me swallowing objects or for whatever reason. If I had not been contacted, I would probably still be out there doing anything I could to hurt myself, going to the hospital.
We really focus on building trust with clients. And we focus on basic needs first. Things like making sure that the person has food, that they have shelter, and that safety is paramount.
Somehow she found me through many falls, many hospital visits, many ambulance rides, many concussions, many seizures. It's been a blessing in disguise, one that I never anticipated in my wildest dreams. First off, that I'd ever be homeless, and secondly, that I'd actually have a real person that would talk to me, not as a robot talking to a paycheck.
This community has embraced this aspect of healthcare much greater than I could ever have imagined.
I have 5 frequent users that, after being referred to TC 911, completely stopped calling. Our crew told me they ran into this patient and she was lively and happy and grateful and a totally different person than they saw before.
There's a few times even the paramedics didn't think I was coming out of it. Meeting Kelly was pretty much a godsend. She's done a lot of footwork. Keeping track of me. I'm just tired of fighting it. I'd be dead right now. You wouldn't be talking to me, you'd be talking about me. I just want to be a socially accepted member of this society. Have something to put in instead of always take out.
If the TC 911 program ceased to exist, our frequent user population would increase because it's had a tremendous impact.
The program in general has been incredibly successful.
I believe that had it not been for the Tri-County 911 service and for Kelly, that my daughter and her husband would be homeless. They'd be on the street, maybe dead. The agency fills a need that exists that I cannot take care of.
It's cared for more people than we expected. It's reduced emergency department visits more than we expected. It saved more money than we expected, and it saved more lives than we ever could have imagined.
I can honestly say that today I have over 6 months clean and sober. I start school on March 30th to get my CDAC to become a drug and alcohol counselor. Everything's gotten a lot better.
This group of people, before this program, more than 1 in 10 died every year. Since the program's been initiated, only 1 in 50 has died. So it's an amazing improvement in something that's priceless.
I'd like to say thank you very much from the bottom of my heart.